Good day, and welcome back. In this session, we will study neonatal and young infant care. But before we dive into it, let's take a few moments to review what we covered in the previous module. We learned that shock is a life-threatening failure of circulation in which tissues do not receive enough oxygen and nutrients. Early recognition is essential to prevent organ damage and improve outcomes. We also explored the common causes of pediatric shock, including dehydration, sepsis, hemorrhage, anaphylaxis, burns, and cardiac conditions. Finally, we examined the clinical signs used to assess tissue perfusion, including pulse quality, capillary refill, skin appearance, urine output, and mental status. Now that we've refreshed our understanding of the previous session, let's look at what we'll be focusing on in today's lesson. By the end of this session, you should be able to 1. Explain what makes neonatal and young infant care different from the care of older children. 2. Discuss the essential care every newborn should receive after birth. We will begin today's lesson by understanding what makes neonatal and young infant care different from the care of older children. Neonatal and young infant care is different because this period is a time of major physiologic transition. The baby must establish regular breathing, maintain body temperature, feed effectively, regulate glucose, adapt circulation, and resist infection in a body system that is still immature. In simple terms, the newborn is learning to survive outside the womb, and even small disturbances can quickly become serious. Unlike older children, newborns may not show loud or obvious symptoms at the beginning of illness. But a severely unwell newborn may simply stop feeding well, move less, cry weakly, breathe abnormally, or feel cold. Because of this, clinicians must take subtle changes seriously and assess carefully. The younger and smaller the baby, the less reserve is available when a problem begins. This is why preterm infants, low birth weight infants, and very young infants require especially close attention. Note: in neonatal care, quiet abnormality may be more dangerous than dramatic complaint. Now that we've seen why the neonatal period requires such close attention, the next question is, what care should every newborn receive to support a safe and healthy transition after birth? Let's look at essential newborn care. Essential newborn care is the set of early clinical actions that support a baby's safe transition after birth and reduce the risk of preventable complications. These actions are basic, but they are also life-protecting. These steps matter because the first hours and days of life are a high-risk period. Good essential care reduces the likelihood that a baby will become hypothermic, hypoglycemic, dehydrated, infected, or poorly oxygenated. These essential newborn care includes 1. Establishing breathing. 2. Keeping the baby warm. 3. Supporting early and effective feeding, such as latching properly. 4. Promoting clean care and infection prevention. 5. Observing for abnormal signs. 6. Supporting the mother or caregiver in newborn care. Before we end this session, let's quickly recap the key points we've covered today. First, we learned that the neonatal period is a time of major physiologic transition during which newborns must adapt to life outside the womb. Because their body systems are still immature, even subtle changes can indicate serious illness. Next, we discussed that essential newborn care consists of simple but life-protecting actions that support the baby's safe transition after birth. Finally, we emphasized that every newborn deserves consistent, high-quality essential care because routine newborn care helps prevent avoidable complications and promotes healthy early adaptation to life outside the womb. Thanks for watching. See you in the next session. Bye for now.